Hey Beebs, happy Thursday. Today is Thursday, May 6th, and it is National Nurses Day and World Password Day. So if you could all send us your passwords, that would be great. Um, and then on to Tanya for today's announcements.
Hi, I'm Tanya and I'm with Yearbook, and I just wanted to let you guys know that the last day to buy your yearbook is on May 24th. And if you're a senior and you have a quote that you want to send in, the last day you can do that is May 14th. If you have a sibling at BHS, please send your picture to Miss Nakatani. And if you have like your group of friends at BHS, please send those pictures too to Miss Nakatani. Thank you.
Thanks, Tanya. Well, I'm here, everybody, to talk about May being Mental Health Awareness Month. So we've done some different things in past years to sort of celebrate this month and bring about awareness for mental health needs in our community. So if you see little green ribbons, this green ribbon is sort of the symbol of mental health awareness. So we'll have these around campus. If you wouldn't mind wearing one, you can wear one to support reducing stigma around getting help. You can wear one to show that maybe you're somebody who has had mental health struggles and want to identify yourself, that there's nothing wrong with that we all have mental health needs in our lifetime. In fact, 1 in 5 adults will have a mental health disorder in their lifetime. Okay, 1 in 5 adults. And we also know that most of those things, the symptoms started during childhood. And I'm going to ask all of you, Olivia, Tanya, and Mallory, what do you think the average amount of time is between somebody experiencing some symptoms of a mental health disorder and getting treatment or getting help?
Maybe like a couple of years.
Couple of years?
I would guess 2 to 3 years.
Okay, Mallory. Tanya, what do you think?
About the same, yeah.
2 to 3 years. The average time is 11 years. 11 years. And part of that is because of stigma, that people feel like there's something wrong with me. I mean, think about it. If you had like a cut, maybe, or a broken limb, you probably wouldn't wait 11 years to go get help, right? And there's a lot of things we can relate that to in our lives, of where society seems to say it's okay to get help for these things, but not for those things. So we're doing a better job. And I think part of that is all of you young people really saying, like, we want to talk about this more. And so I, as an adult, I'm a trusted adult. I would like to think somebody that students can come and talk to. But we also know that the real power is in your social network and what you and your friends talk about to each other. So over the month of May, we're going to be doing some things to highlight things like what we call our sources of strength. So we'll have some things like this: what helps me with anger, anxiety, depression, or I'm stronger in, and things that you've done in your life that have helped to build hope, help, and strength. So it's kind of moving away from those messages of like sad and shock and trauma and grief and all of that, to really, like, we all deal with mental health issues in our lifetime, but what helps us to be stronger and what helps us in those moments. So if you see some students out promoting this, or if you see myself or our counseling team or our school psych, please stop and talk to us. We want to have these conversations with all of you and just continue to bring awareness to Mental Health Month. And we'll probably be back on here for some more announcements. So stay tuned. Thank you.
Absolutely. Thank you so much for joining us, Ms. Stewart and Tanya. And that's all we have for you guys for this week. So peace out, beeps.